Children interact every day with those around them, adults and other children alike. In each of these interactions, children use their social competence to guide their behavior. This video will provide a brief introduction to social competence, how it intersects with language, as well as assessment and intervention considerations for children who experience social competence and language difficulties. Timler, Vogler, Elias, and McGill define social communicative competence as skill for influencing others and interpreting social situations. Hahn and Kempel have defined social competence as effectiveness and appropriateness in human interactions and relationships. Lim, Roger, and Brown, based on McFall's definition of social competence, define it as an evaluative construct based on the judgment that a person has performed tasks competently. Lastly, McCabe and Meller have applied Marshall et al.'s definition to define social competence as being a repertoire of skills, including knowledge of social standards of behavior, social problem solving, emotion recognition, emotion understanding, and communication and language efficacy. Social skills are the building blocks that make up social interactions. Research has shown that social skills include abilities such as appropriate language use, maintaining interactions with different people, conflict resolution, and the ability to take another perspective. Social skills can also include abilities that relate more to an educational perspective, such as following teacher or educator instructions, working in groups cooperatively, and completing homework. Social rules are the rules that guide a social interaction. Different rules apply in different social contexts. There are rules that guide the oral use of language, rules that dictate nonverbal communication, and rules that guide full social interactions. Verbal rules include things like using politeness strategies, such as referring to an adult by Mr. or Mrs. as a sign of respect, or using appropriate language depending on who the conversational partner is. Nonverbal social rules include those that reflect the use of gesture, facial expression, eye contact, as well as body position and proximity to others. Finally, rules guiding the entire interaction reflect both verbal and nonverbal components. This includes rules such as turn-taking, topic initiation, topic maintenance, and breakdown reparation. It is important to keep in mind that everyone's rules may be slightly different depending on factors like culture, how a person was raised, and personal preference. The American Speech-Language Hearing Association describes pragmatics as the ability to use language appropriately in social situations. Pragmatics involves using social skills and applying social rules to interactions. This is done in 3 ways. The first is using language with different functions, such as greetings, requests, or directives, as examples. The second is changing communication depending on the conversation partner or context. The third is following the social rules we talked about earlier. Now we'll move on to review how social competence is closely tied to language. Developmental language disorders are defined by Bishop et al. As language difficulties enduring into middle childhood and beyond, with a significant impact on everyday social interactions or educational progress with no known associated condition. As one can imagine, the appropriate use of many of the social skills and rules that we've touched on so far may also depend in part on a child's oral language ability. This has been shown through studies which conclude that children with developmental language disorders are more likely to behave in ways that are perceived as socially inappropriate because of difficulty with interpersonal communication. As previously mentioned, Marshall et al. Include communication and language efficacy in their definition of social competence, which suggests that if defining social competence in this way, children who demonstrate language difficulties may also struggle to develop appropriate social competence. It is easy to see based on these 2 definitions that language and social competence are very closely tied. Difficulties in one may cause, exacerbate, or look like difficulties in the other. Timler et al. Have summarized the literature on the social competency abilities of children with developmental language disorders and report that children with language difficulties are often characterized as withdrawn in social settings, such as free play and negotiations. They tend to initiate fewer interactions with their peers than children without language difficulties, and they respond less frequently to peer comments and questions. There is also a subgroup of children with language difficulties who display pragmatic difficulties, such as staying on topic or monitoring their partner's interest in conversation. Because these two constructs are so closely intertwined, it can be difficult to assess and provide intervention that targets areas of weakness. Different areas of social competence can be assessed using different assessment tools. Various standardized tests have subtests or sections that target different areas of social competence, such as subtests in the SELF-5 and the PLS-5. Rating scales can also be used to assess social competence. There are standardized, reliable rating scales available, which cover a range of ages, using self-ratings, ratings from parents or teachers, as well as observational ratings to assess children's social competence. Two examples of standardized, reliable rating scales are the Child Behavior Checklist and the Social Skills Rating Scale. Observing the child, formally or informally, is an assessment method that can be used to see the child in a more natural setting and identify behaviors that other assessment methods don't necessarily assess. Examples of tools to help when observing a child's interactions to assess their social competence are the Child Behavior Checklist and the Peer Social Behavior Code. It is crucial to remember that social competence and language are very closely related whenever assessing a child's social competence. Keep in mind that some of their behaviors may stem from language difficulties, some may stem from social competence difficulties, while others may stem from difficulties in both language and social competence. For these students who experience difficulties in language and social competence, it is important to target both during intervention. Westbleet and Blalock discuss the importance of addressing both social competence and language in intervention because they are so closely related. Progress in one area will not necessarily carry over to the other area, and so each area must be a focus. Timler et al. Describe effective intervention to include enhancement of language and social skills, particularly pragmatic skills, and generalization of these skills during authentic interactions. Timler et al. Also review the four supported contexts for social communication intervention. Environmental arrangement occurs when intervention takes place on a classroom level, with a focus on physically arranging the classroom in an intentional way to promote social cooperative play. Teacher-mediated interventions focus on increasing the teacher's use of verbal strategies to promote peer interactions by, for example, redirecting students to peers when they have questions. Peer-mediated interventions train other children to interact with the child with social communication difficulties. Lastly, clinician-mediated interventions involve taking the child or a small group of children out of the classroom for intervention sessions which focus on learning and practicing skills of social communication. As has likely become clear to you, social competence and language are two constructs which are intertwined and very difficult to isolate, but equally important to successful and appropriate social interactions.